So happy One Health Day to everybody. This is exciting. I know that for those of us in the US, Election Day is on our minds, and hopefully this will give us a little bit of reprieve from that. But yeah, today is One Health Day, and it's an exciting day. I'm going to tell you a little bit about One Health Day, but I want to tell you first um, about One Health here at UT. I'll tell you a little bit more about it later, but I want to tell you about some of the people, introduce you to some of the people who have been very involved in One Health here at UT. So just to start with, we have our leadership team, of which I want to go back to the beginning with Matt Gray and Shige Ida, who were really instrumental in getting any of this, our proposal written up and getting it through at UT administration, really working very closely with them. And our current leadership, I am the interim director. And then we have Nina Pfefferman and Carol Myers, who are associate directors. I am within the Department of Forestry, Wildlife, and Fisheries, as well as the College of Veterinary Medicine. And Nina is in mathematics and EEB, and Carol is in nursing, and she's also had a stint in public health too. And then we have David White, who is Associate Dean for Research here at UTIA, and he has been very instrumental in moving the One Health initiative forward here at UT. His expertise is in antimicrobial resistance, one of his many expertise. And then we have Becky Hardman and Kimberlyn Rosa, who are postdocs and have been helping organize this and the organizing working groups and research teams, and doing a lot in helping move the initiative forward. And then Alyssa Merca, who has helped put this together. She's our administrative assistant, and she is invaluable in helping to organize and communicate with everybody. So we have a really good team that's been working very, very hard on One Health here at UT. We also have a group of scholars. I want to just let you all know, I know some of the scholars are online, but this is a one-year appointment, and it can continue further than that, or they can pass it on to somebody else within their college or their expertise, because that is what we try to represent, is every single college or unit, if there's or center and within UT is represented. And then also, if there's some expertise that we need to make sure that we get covered and it's not covered with one of the other scholars, we try to fill in those as well. So the number will fluctuate a little bit, it will, but we always want to make sure that we have really good representation. And you're going to hear from some of these later. You're going to hear a little bit about what they do. So One Health Day, what is One Health Day? Isn't it awesome that there's a One Health Day? Well, it started back in 2016, actually, was the first one. And it was started by the One Health Commission, the One Health Initiative, or it's the national one, and the One Health Platform Foundation. And these groups got together. Actually, the One Health Initiative is a privately run group. But they got together and decided that we need to get global acknowledgement of One Health. So the goal is to build the cultural will that is necessary for a sea of change on how planetary health challenges are assessed and addressed. We need to make people aware, as we all know, that the only way to move an initiative forward to make people aware of issues that are of importance, and whether it be ultimately is to them personally, is to get the word out there and to help them understand and to educate. And so this is the purpose of One Health Day. It is to bring attention to the need for One Health interactions and to engage as many individuals as possible from as diverse areas, many arenas as possible in One Health education and awareness. So it's super, super important. So what's One Health? Um, there are still many people who aren't aware of this terminology that we use. Like, what does it really mean? One Health is transdisciplinary. That means that we need to consider the communication experts, the economists, the veterinarians, public health professionals, just the lawyers, the policymakers. Everybody comes together, and we take all of those people. We look at some issue that is affecting us, affecting health, and we come up with plans to prevent it, to prepare for it, to detect it, to respond to it, and to recover from it. And this might be infectious diseases because that's often what we think about. But there are so many other ones as well, so many other issues. And we need to remember that it's not just infectious diseases that we are concerned about that affect our health. There's so many other things. So, and it's anything that affects human health, animal health, and environmental health. And we stress here at UT plant health too, because we really, if we're going to have humans and animals separated from the environment, we need to also separate out plants, right? So we want to consider all of those factors. Health is interconnected. Problems are shared. And I love this photo that was taken by a colleague of mine because it really emphasizes that we have animals, there's wildlife in there, we have the forests, we have agriculture, we have water, we have people, we have the living creatures in the water. All of this is affected by any one of these things is affected by the health of any of the others. And that's super important. And we also have to consider things like water quality, soil quality, air quality. Few examples of One Health issues, as I like to call them, because it seems like a broad term, I know. Biodiversity laws. People don't always understand, why does biodiversity matter with health? Well, it does matter. I've heard it described where if you have a society and everybody has their job within that society, if you take one of those jobs totally away, society isn't going to function the same. And it's the same way when we think of biodiversity within our world. We've got to have that so that things function properly to maintain health. We have emerging pathogens. We know that with COVID, right? We have food insecurity. This is a huge issue, even in our own country, which is crazy. There are many Tennesseans every day who deal with food insecurity. Loss of pollinators. We have contaminants. We have changing climate, stressors, invasive species. So many things that we need to think about with when we're looking at One Health. So why is this approach being implemented worldwide? Why? Well, because we're realizing that if we can get on the front end of things, it saves us a whole lot of issues later on, a whole lot of money too. So we really need to get to tackle things before they become a problem. And the way to do this is to be organized, to be coordinated, to look at all the different factors that go into that. When we do that, we maximize the benefits because we're not duplicating what somebody else is doing if we're looking at research or anything. And when you don't duplicate, then people can do different things. Groups can work on different problems, but they can all be things that fit together and that will help solve a problem. So this is super important. And this And also there's only so many resources available other than money even, right? There's only so much equipment. So we're able to share all of this. And when we share and when we work together, we can really accomplish a lot more. And there have been some studies that have looked at what, something you might have exposure in animals. We could follow this with COVID, right? Have exposure in animals, start to see clinical signs in animals. Then once you have exposure in humans and you start to see the clinical signs, that's when the cost skyrockets. So if we could tackle these issues, for example, something like coronavirus, at the start, and we could prevent or at least reduce spillover into other species and ultimately into humans, we could really avoid a lot of the problems that come later on. So that is just an example of what using a One Health approach is designed to do. But things are going to happen no matter what, right? So we still need, once they do happen, we need to be able to respond to them and to address them and to tackle them. And that takes a One Health approach as well. It takes people, and we're seeing it play out with COVID, from all different disciplines coming together to tackle things, to keep our the world moving forward. Daily life has to move forward, but also how do we develop treatment? How do we come up with vaccinations? How do we prevent this from getting worse? All of these things that we need a team to work on. We've had a lot of issues just this past year. The year started out with the fires in Australia. We're having fires in California now, right? And it's amazing how, it's not just the loss of lives, but we were dealing with the loss of species. We were dealing with reduced air quality, and mental health issues come into play. So there's so many other health aspects that are affected by one type of event. And it's not just in that area. It will impact the health in other areas as well. I always say that I was in New Zealand at this time, and I could even smell it and see it in the smoke in the air. So it has far-reaching impact, and we have watched that play out with COVID. We've watched it move across the globe to where it's reaching everywhere, and it is impacting our lives in so many ways, not just our physical health, but our mental health, our economic health, it's just every bit of our life is being impacted by this. So this is an example, and this is only one of many types of examples. And we have other things, right? And COVID is not the only issue that's going on in our life right now. There are other things that we need to constantly be thinking about. And I like to bring this up because sometimes when we think we're even doing really good things for our health, we might not be, we are not thinking always about the other impacts. So something as simple as sunscreen or insecticide that we all put on ourselves to protect ourselves uh, can be impacting our environment and maybe impacting us in other ways too. And again, it's teams of people researching this and then coming up with alternatives. So Hawaii has been the first state, I believe, to start banning certain sunscreens because of the damage it's doing to the environment. And we are recognizing this. Why are we able to detect chemicals that are in sunscreen or an insecticide in marine animals that live way out in the free ocean? That is odd, right? So it makes us think about and realize how interconnected we are with our environment and how this needs to be something that we consider every day in everything that we do. So Why is UT interested? Well, hopefully, just because of what I introduced there as far as One Health and what is One Health, it seems obvious, right? But it's even more than that. We have so much expertise here in every single aspect of any discipline that can work on any One Health issue, and putting these people together, organize in a coordinated fashion is awesome. We're already all working on a lot of these issues. So when we can work together and coordinate, it makes us so much more powerful, more strong. And we have these research and education centers that are spread across our state, which is awesome because they provide great sites to do One Health research. We have these travel corridors, I-40, I-75, where contaminants, exotic species, zoonotic agents, all kinds of things can travel. So these can be areas for us often to concentrate on when we are doing surveillance. And we have Nimbus here. Nina Pfefferman is with Nimbus, and it is an amazing group of people who can help with modeling, help with the mathematics. It's really awesome. And then just down the road, we have Oak Ridge National Laboratory with Summit, the supercomputer that can handle these large data sets that come from these types of studies. So there's a lot of past headliners in Tennessee, for example. We've had the Kingston coal ash spill, an increase in lacrosse virus, encephalitis, opioid crisis, the food insecurity, avian flu. So we've had a lot of those, and we still have more. Many of those we're still dealing with. We have new ones. We have COVID, as you know. We have the longhorn tick, and we have chronic wasting disease. These are threats that are not going away, and they're going to cost us a lot of money. So being able to tackle them in a coordinated fashion is super, super important. So I already went through our leadership. We have an external advisory board, and mentioned our One Health scholars. We have partnerships within UT and outside of UT, and we're building those every single day. In the short term, we are going to continue to form these partnerships, create teams. We're doing outreach, training, and research. And we, long term, want to become self-sustaining and evolve into a globally recognized center. So we're putting plans into action. We are, forming research teams and working groups. We are doing public outreach and creating a seminar series, and we're really focusing also on education and training. We're putting forward a minor in One Health, hopefully going to have plans for coming up with a certificate program and online courses, and just doing as much as possible to build the One Health initiative here. So with that, I am going to talk about what we have planned for today. All right, so it's exciting for today. We have two of our main, our featured presentations. The first one's going to be from Dr. Laura Kahn, and the second one from Dr. Adam Griffith. And I think they're really going to be exciting presentations. Dr. Kahn's is a pre-recorded, but then we're going to have like a panel discussion after it, where people will respond to her presentation, and then you guys can ask questions to the panel. And then Dr. Griffith's presentation will be live. And this is an area that I'm really interested in because it's talking about, he's going to present on Indigenous people and living with the land and how that can really improve health for the environment and for people as well. And this is pretty exciting time for us, because I think we're starting to realize that in in every country is taking note of that the indigenous people within that country have so much knowledge, and we really need to value their culture, because so much of what they've done to sustain themselves through the years really are things that we kind of are circling back to and realizing can be good practices for a healthy environment. And ultimately, a healthy environment means healthy plants and healthy animals and healthy people. So this is something that I've been particularly interested in. I just want to let everybody know that everybody's automatically muted, and you won't be able to unmute yourself. So you'll need to use the raise hand function to be unmuted. You can also type a question into the chat at any time. And if a session ends early, we'll stick to the schedule and allow for time for a break before the next before the next session begins. So after Dr. Khan and Dr. Griffith speak, and again, there's going to be time for questions after each of these, then we are going to have 2 talks that are about some local research projects that are taking place here at UT. Those will be a little bit shorter talks, but we have slated a half-hour total for each of those, with a time for question and answer at the end of each of those. And again, it's going to be the same way, where you can use your raise a hand or type your question into the chat. And for those, we have recorded them as well. However, the speakers will be there to answer questions. And we did this just to make sure to try to avoid as many glitches as possible throughout the day. And then after that, we will have presentations from the UT One Health scholars. And what we did is we made little 3-minute presentations that are voiceovers. You'll see some slides will come up with their picture and a little bit about what they do, and then there's a voiceover where they will talk a little bit about what their interests are and what they do. I don't think we have one from absolutely every scholar, but we've got one from most of them at this point, and those will be hopefully will fit nicely into that time period. And then there'll be some closing remarks from Drs. Hardman and Rosa. They'll tell you a little bit more about what some upcoming events are, emphasize again a little bit about our One Health initiative and what you might be looking for. So it'll be, I think, an exciting day for you.